and the factor of pediatric cases, I think, is often neglected. And obviously the asymptomatic case rate kind of speaks to that, but also highlights the issue of this really needs to be front of mind, right?
Yeah. Yeah. And, one thing, so our study does allow us to estimate with some confidence this rate, right? Which is, like I said, for San Francisco, 1%. What it doesn't tell us is how infectious those kids are, right? And that's still very much an open topic out there that we need to learn more about. It may be that this 1% is dealing with all kids 0 to 18. It could be that younger kids are less affected, older kids are more likely to have it. We do know that kids can continue to shed virus and test positive, for weeks after they've had their primary infection. So this 1% may be a bit of an overestimate, but just to put it in a little bit of context, with a prevalence of 1%, if you have a class of, say, 33 kids, right? That's the standard size of a 4th grade class at San Francisco Public Schools. If you have a class of 33 kids, even if they're all asymptomatic, with a prevalence of 1%, the chance that at least one kid in that class would test positive for SARS-CoV-2 is roughly 30%, which is really high, right? And that's just for one 4th grade class.
One class, yeah.
So even if you assume that not all of these asymptomatic carriers are infectious or very infectious, the number of kids out there that would test positive is just too high.
Yeah. I remember very early into this, I think some of our first research in closed environments, and I don't want to make a connection between the two facilities, between school and prison, but what we did see in prisons, of course, was the greater transmissibility once you have someone in a place that's not perfectly hygienic or designed to be a space where people can keep a safe distance. And we've certainly had our discussions already with pediatric experts about the fact that kids aren't perfectly hygienic, and a school is a place where has a reputation for teachers or faculty coming home with colds, sneezes, whatever they brought home from the kids that day, right? So it just kind of adds to that concern.
Yeah, and it from what we do know about COVID, there may be significant differences, especially in the infectiousness of younger children, that sort of go against our prior notions of kids transmitting a lot of other kinds of respiratory illnesses. So I think that is there's decent evidence so far that it's really the older kids that are probably more vectors of transmission than the younger kids, which is honestly different from what we normally think. But it's still, broadly speaking, an issue, especially in middle schools and high schools and colleges, which is what we've seen with a lot of the reopening recently.
And Dr. Chan, you mentioned, of course, the viral shedding, disparity is something that we're still trying to interpret, especially in pediatric asymptomatic cases. But, I mean, the big crux being exactly the risk of severity, even from asymptomatic transmission. Do we have an understanding of the severity and risk of severity?
I'm not an infectious disease doctor.
Yeah.
And, I've been following some of this, but from my understanding, it's still very much an open question. There are certainly studies that suggest that the viral load is quite high even in young children. But that does seem to conflict with some of the epidemiologic data that suggests that younger children don't seem to be as significant, vectors for transmission. But I don't really, I think there's a lot that we still don't understand about this disease. And I really applaud the work of everyone who's doing all of that really difficult difficult work to understand the nuance of that.